The new coronavirus, COVID-19, is a respiratory virus. So think about it as you might with the flu in terms of how it's transmitted. So it's something that's transmitted through the respiratory route, through droplets. So somebody sneezes, they sneeze into their hand, then they shake someone else's hand, and then that person touches their face. Or you're standing next to somebody who is infected, and they sneeze, and the droplets land on their face or their mouth. And so this is transmitted through the respiratory route, similar to other types of viruses. It does appear to be more severe than the flu. Now, we don't know exactly how severe it is because this is relatively new. It was discovered just a few months ago, first in Wuhan, China, and now spreading around the world. It appears at the moment that about 80% of people who get COVID-19, the new coronavirus, will recover without issues. It'll be like a cold or a flu, and they recover without needing hospital care. About 15% to 20% will require a higher level of care. And at the moment, it appears that the death rate is somewhere between 1.5% and 3%, which is higher than the flu. It is lower than SARS, which is another coronavirus, lower than MERS. SARS has a mortality rate of about 10% and MERS at about 30 to 40%. Most important thing to keep in mind, this is a respiratory virus. And it's relatively new, so things are quickly evolving, and there are things that we can do to protect ourselves from getting it the same way as we would protect ourselves from getting the cold or the flu. In a time of public health emergency, transparent, open, clear, and truthful communication is really important because public health hinges on public trust. What federal officials should be doing is to provide clear updates about what it is that we know, what it is that we don't know, and what's the timeline for helping us to get these answers. Then one more thing. Right now, the risk to the everyday person in America and here in Maryland and in Baltimore is low. But we should get prepared. Just as we would for snowstorms or hurricanes or any other emergencies, we should be prepared. So make sure that you have a 30-day supply of your medications on hand. Have a plan for your family. If you have children and schools may end up getting closed, or if you have elderly parents or grandparents and people that you're caring for, have a plan for how you will help to take care of them in the event of emergencies too. These are all things that we can do now to protect ourselves and our loved ones. So I'm getting asked about masks all the time, and here's the answer. Healthcare workers need to wear masks, and they need to wear a very specific type of mask called the N95 respiratory mask. That's useful because healthcare workers are in contact with individuals, they're doing procedures on patients, and they have to be protected. But masks are not useful for people, for everyday people. And here's the reason. The surgical masks that we generally wear, the ones that you see as the common mask, they're intended to protect other people from you, in the sense that if you are wearing the mask, you are someone who is ill. So if you cough and sneeze, you cough and sneeze into the mask and not onto other people. It actually does not protect the wearer from other things around them. So a short answer is no mask unless you are a healthcare worker or you're somebody who has an infection and you want to protect other people from your sneezing and coughing.